Good afternoon, everyone. I am Dr. Sambit, endocrinologist and diabetologist. I am working at Aptly Hospitals, Bhubaneswar, and also Endeavor Clinic, Bhubaneswar. So, as you all know that we are passing through a very tough time of COVID-19, which is a pandemic, and WHO has also declared it a deadly pandemic. And we know that this virus is, the coronavirus is not new. It is already there. It starts in 2003 and Middle East Respiratory Syndrome in 2012, and it has caused havoc at that time also. But this time the mutated virus is quite infectious and it can also affect the lungs very severely. So that is a concern for all of us. Now, since as a diabetologist and an endocrinologist, we always face the problem of how our diabetic patients actually respond to this pandemic. And there are few instances and anecdotal things that actually the SARS affects the diabetes and diabetes also affects the SARS. So there is a bidirectional flow in that condition. And the thing is that the diabetes, for a patient with diabetes, it's not that infection is more common, but if somehow the infection occurs in a diabetic patient, then the severity is more actually. And the chances of lung infection or the lung involvement with respiratory distress and going to ventilator and the mortality is quite high if a diabetic patient develops the SARS infection. Second thing is that if someone who is having diabetes suffers from COVID at this time, the glucose fluctuation is quite high and there might be features of hyperglycemia or hypoglycemia also, and there is wide fluctuation. Children with type 1 diabetes can develop diabetic ketoacidosis and type 2 diabetes can develop hyperglycemic hyperosmolar state. And when we go into high stages where the glycemic control has to be maintained. Now, there is one point which we must understand, that why the diabetic patient has got more severity in the infection. Because the diabetic patient is a state of immunocompromised state, and the infection becomes more manifest and more multi-organ, more rapid. So, for all diabetic patients, our advice is to stay safe, be safe, remain at home, don't go out more frequently, try to remain at home only, and if at all they are going out with some emergency, they should be using face mask. The social distancing has to be maintained at all the time, always maintain at least 8 feet distance from any person whom they are meeting, and always try to cover your face either with a handkerchief or with the end of your elbow if you are sneezing or coughing. And if you are not feeling well, then try to self-quarantine, try to be at your home in a given room and don't mix with the other people in the house. The second thing is that keep hydrated and don't get dehydrated, and there are some medications which can actually produce dehydration that has to be taken care of. And frequent hand washing, hand sanity has to be maintained. Like every 2 hours you must wash your hands with open water or with a alcohol-based sanitizer which has got alcohol content of more than 60%. And if you are feeling ill or if you have flu-like symptoms, then immediately call your local medical personnel or to the government organization which is COVID-dedicated hospital or COVID-dedicated center. Now, there are some simple guidelines also I wanted to convey to a diabetic patient. Now, if at all you feel fever or something like that, then as I have told you, stay hydrated. Check your blood glucose frequently with your blood glucose meter, and if you have a ketone strip, then that is still better. You can check your ketones in the urine. That means you are not going into serious problem in the glycemic control. And if you are on insulin, more supply of insulin with you, and keep the pens ready and keep the needles more available to you because they have a lockdown which may be extended. So always be in touch with your local pharmacy for getting those things. And if this so happens that your doctor may consult you to change over to insulin, so always be in touch with your doctor over telephone or by video consultation or with the teleconsultation. So general practice I have already told, must do social distancing, must take care of the hand hygiene. Stay at home, be safe, and my only advice is that follow the rules what the central or your state government is telling. So with that, I'll end. Thank you.